2020, 68,630 overdose deaths in the United States were opioid-related, and synthetic opioids were involved in over 80% of them. Researchers have been hard at work trying to understand and mitigate the opioid crisis, and one line of work is focused on a fentanyl vaccine. That's the topic of this week's Healthcare Triage. Fentanyl is a synthetic opioid that is up to 50 times more potent than heroin and 100 times more potent than morphine. There is pharmaceutical fentanyl, administered by doctors for things like surgery and advanced illnesses like late-stage cancer, and there is illicitly manufactured fentanyl, which is the culprit in so many overdose deaths. Recently, news broke that a fentanyl vaccine is in the works. While headlines presented the research in a way that implied we've already got the vaccine, it's not quite there yet. But it's still exciting to the research. This study, published in the journal Pharmaceutics in October of 2022, reported that a fentanyl vaccine led to significant levels of anti-fentanyl antibodies and reduced levels of fentanyl in the brain following exposure to the drug. In addition, taking fentanyl can cause antinociception, meaning reduced processing of unpleasant and painful stimuli, and this effect was also reported to be neutralized by the vaccine. Importantly, no adverse effects of the vaccine were noted, and the antibodies bound specifically to fentanyl, not to morphine, methadone, buprenorphine, or oxycodone. So it appears that the vaccine would not block important addiction treatments and wouldn't block the ability of opioids prescribed to treat pain, though as we've discussed before, prescription opioids have a whole host of issues of their own. But setting that aside, these results are pretty encouraging. Note, however, that the study was conducted in rats. That isn't bad. In fact, it's 100% necessary along the path of vaccine creation. I'm just pointing it out because it means there's still a lot of work to do before we know how effective this will be in humans. In the current study, we know that the vaccine affected the processing of unpleasant and painful stimuli because rats who were administered the vaccine and then administered fentanyl reacted more to tail flick and hot plate assays, which are measures of pain response in rats, than unvaccinated controls who were given fentanyl. Another interesting detail in the report is that the vaccine prevented fentanyl-induced physiological responses, like decreased heart rate, in male but not female mice. This may have to do with the fact that fentanyl had a greater effect on these measures in unvaccinated male mice when compared to unvaccinated female mice, meaning that males appeared to be more affected by the drug. It's unclear how this relates to humans since other research suggests that these responses to fentanyl do not appear to differ between sexes in human beings. However, data do suggest that women can respond to illicit drugs differently, so it'll be important to hash all this out in clinical trials someday. So, long story short, the hope for a vaccine is that it would block the high that comes from taking fentanyl by preventing it from getting into the brain. With the support of these data, the researchers are working on making clinical-grade vaccine, and their press release mentions that clinical trials in humans are being planned. If successful, this could be an incredible tool for relapse prevention. It would also have the added benefit of aiding people who take fentanyl unknowingly when it has been cut into other drugs. That's important because a very small dose can be lethal, and obviously there's not much oversight in the manufacture of illicit drugs. And I emphasize that it would be a tool, not a solution on its own. We've still got battles to fight with prescription opioids, which are unaffected by this vaccine, and the overarching issue of drug addiction in general, with its large and persistent relapse rates. But we're chipping away at the iceberg, and we'll take one more pickaxe. Hey, did you enjoy this video? You might enjoy a whole series we did in 2020 on opioids. We'd also appreciate it if you'd like the video. Consider subscribing to the channel down below. Maybe go on over to patreon.com/healthcaretriage, where you can help support the show, make it bigger and better. We'd especially like to thank our research associates, Joe Sevitz, Edward Lillaholm, and Brian Nam, and of course, our Surgeon Admiral, Sam.